Hare Krishna.
Hare Krishna.
A very warm welcome to all the participants who have joined to yet another exciting topic on health live on Hare Krishna YouTube channel. I'm Yograj representing Bhaktivedanta Hospital and Research Institute, which is a 300 bedded multi speciality tertiary care NABH accredited hospital which is located in Mumbai, Mira Road. We offer holistic healthcare services for body, mind, and soul with the advantages of allopathic, Ayurvedic, homeopathy, and alternative medical therapies under one roof. We integrate modern medical knowledge with holistic approach to promote overall well-being. Our experts emphasize the importance as a cornerstone of preventive healthcare. This initiative is a part of our flagship program, ISKCON Devotee Healthcare Services, which was launched in Mayapur in the year 2023. Through this service, we have supported the health and well being of over 10,000 devotees globally. Today, we are live on the special health talk show, which is on Panchakarma and its benefits, that uncovers how this ancient Ayurvedic practice can help detoxify, regenerate, and restore harmony to the body, mind, and soul. Let me introduce to our esteemed guest and speaker, Dr. Nanasaheb Memane,
Hare
His
Krishna.
Grace Nirmal Chandra Das, our esteemed consultant and head of the department Ayurveda, with over 18 plus years of devoted service, will delve into the profound science of Panchakarma and its benefits. So let's begin with the podcast.
Hare Krishna.
So, the first question: can you explain what Panchakarma is and why it holds a central place in Ayurveda?
Yeah, very basic and important question. So, as the word Panchakarma goes, Panchakarma is a Sanskrit word. So, Pancha means five and Karma are actions. So, there are five actions which are done towards sta- reinstating the health in the patients. And those Panchakarmas, those five actions are Vaman, Virechan, Basti, Nasya, and Raktamokshan.
Mhm.
So, Vaman is actually the natural herbal emesis. Virechan is a purgation. Basti is herbal enema or plant-based medicine, oil and decoction-based enema. And Raktamokshan, that is bloodletting, and Nasya is nasal administration of the medicines. So these are basic five actions which are done towards comprehensively achieve the holistic health benefits which includes body, mind, and soul. So what was the next question?
Next question is, sir, what is the philosophy behind Panchakarma and how does it work to detoxify and regenerate the body?
Yeah. So Rogaha sarve api mande agano. Actually, in Ayurveda, the cause of all the diseases is considered as the affected Agni or improper Agni. What it causes actually, improper Agni increases the toxins inside.
Mhm.
How it increases the toxins? As the eliminations of the toxins due to wrong lifestyle and wrong diet
Mhm.
and some environmental and some self generated stressful situations actually affects the digestion of the patient, and those affected digestion, it hampers the elimination of the toxins and absorption of the nutrition which we considered in Ayurveda as doshas. Doshas is a
Correct.
toxins,
Yes.
vata, pitta, and kapha.
Mhm.
And when these doshas are accumulated in the body beyond certain limits, it forms the disease. And according to Ayurveda, these toxins needed to be thrown out every day on proper time in certain quantity.
Mhm.
So the Panchakarma steps in where the abnormality in the proportion of doshas takes place inside.
Correct.
So this Panchakarma actually basically what it does, it addresses the elimination issue of the toxins.
Okay.
So when we perform this Panchakarma, so
Mhm.
nearest root, whatever doshas like vata is affected, kapha is affected, pitta is affected. When kapha is affected, then the nearest route to expel out the kapha is vomiting,
Correct.
and for pitta it's loose motion.
Mhm.
So the principle based on basic principle where Panchakarma is based on is to eliminate the toxins.
Mm-hmm.
Not only this, after eliminating the toxins, the systems are cleared and cleans the systems, and then these clean systems, there is reinstatement of the balancing Vat, Pitta, and Kapha.
Okay.
So throwing out the toxins and
Mm-hmm.
balancing the Vat, Pitta, Kapha in order to restart the systems in a healthy way.
Correct.
So
Correct.
this,
So why Panchakarma is referred to both cleansing and a healing therapy?
yeah, just we discussed some points about it. As uh, detox, as I explained, ki Vat, Pitta, Kapha, the toxins are thrown out in the near from the nearest root of the systems.
Mm-hmm.
So as the toxins go out, there is a vacancy created.
Correct.
This vacancy is nothing but the clear system, like some pipe is blocked,
Mm-hmm.
and like gutter, in gutter the pipe is blocked due to thick water, which is muddy and dirty water.
Mm-hmm.
So we have to systematically remove that blockage of that pipe, and
Yes.
as soon as the blockage is removed, the pipe is very clean, and then we can allow normal water to flow through that. Similarly,
Correct.
when the space is generated, which is making the system clean, then the doshas which are generated normally,
Mm-hmm.
because our body needs normal quantity of doshas also.
Correct.
It's not like doshas are the always toxins.
Mm-hmm.
Doshas are very much required. They are energy complexes in our body, and they are very much required for the smooth functioning of all the systems.
Correct.
So the normal regenerated doshas, they actually travel smoothly
Mm-hmm.
through the systems,
Correct.
and this smooth movement of the system actually reinstates the balance, and as the balance is created,
Correct.
health is established.
Yes. Yes.
So panchakarma simultaneously work as a detoxifying
Mm-hmm.
and health reinstatement.
Okay. So as you said, there are five core therapies of Panchakarma,
Yes,
and they have their specific purposes.
correct.
So can you just let us know, or just have a walkthrough for
Yeah,
all this?
yeah. We can definitely have, because
Yeah.
they are very important for today's discussion,
Yes.
as they are quite uh, explained in detailed manner.
Mm-hmm.
Although we cannot discuss in detailed manner,
Correct.
but uh, the basic purpose of woman, purpose of woman is to remove the mucus which
Correct.
is improper or inadequate or more more abnormal in quantity
Mm-hmm.
through mouth by emesis, yeah, vomiting,
Correct.
and it detoxifies stomach, respiratory tract, and some part of small intestine.
Right.
And how it is done actually, some herbs or milk or some other medicines, liquid medicines, they are put inside, and then the patient is allowed to vomit in controlled manner under
Mm-hmm.
the supervision of ayurved consultant.
Correct.
And as the msc is done, then post panchakarma is done. Post
Mm-hmm.
panchakarma, that is samsarjan krama, is done.
Right.
And what it does actually in respiratory disorders, especially respiratory disorders and gastric disorders,
Mm-hmm.
it helps to get relief from asthma and hyperacidity
Correct.
and allergic cough, like that.
Mm-hmm.
And next is virechan. The purpose of virechan is to remove abnormal bile and abnormal toxins
Mm-hmm.
from liver, small intestine, through loose motion.
Okay.
So for that loose motion, we use certain medicines as per the personality and the disease demand and the age of a person,
Mm-hmm.
and this depending upon the preparatory procedure which is done for that patient. So we choose this, select the medicine, and then with that medicine, the procedure is done. 10, 20, 30 numbers of loose motions are there,
Okay.
and this actually helps in bloating, constipation, skin
Mm.
diseases, especially the
Correct.
diseases which are there caused due to blood disorders
Mm-hmm.
affected by pitta.
Okay.
And there is basti. Basti is up to two types: is decoction basti and oil basti. So basti is done for eliminating the toxins from large intestine, and it is done with the herbs and again milk, medicated water, and it is done for specially vat related disorders, that is
Okay.
arthritis,
Correct.
bony degeneration, whole
Mm.
body dryness induced disorders, which helps there a lot.
Mm-hmm.
Nas is again nasal root, administration of the medicine,
Correct.
which detoxifies, nourishes, and heals the diseases staying at brain level and whole body also.
Mm-hmm.
And last is Rakta Mokshan, that is bloodletting. So taking out some blood from the
Correct.
body.
Yes.
It is considered as the abnormal blood.
Mm-hmm.
So that blood is removed with the help of three ways. That
Okay.
one is leech application,
Mm-hmm.
one is taking out the blood uh, through needles, and one is negative suction method.
Correct.
So, as some people majorly know about cupping therapy,
Mm.
so cupping therapy or alabu or shrunga, that is the horn of the deer. So, we create negative suction inside and it actually absorbs the abnormal blood from the body.
Correct.
So, these are five different types of panchakarmas in short
Hmm.
way.
Sir, we need to understand like what is the significance of Purva Karma, that is preparatory phase
Yeah.
before undergoing Panchakarma.
Yeah. Purva karma is very important thing for panchakarma, as uh, we should know panchakarma is, although it is comprehensive process, but it is aggressive process
Correct.
to heal the disease.
Yes.
So the example is given by our elder teachers
Hmm.
that when some mischievous student is there in class, so if he is doing some mischiefs,
Mm-hmm.
then the teacher tries to pacify that by telling, "Arey, sit down, don't do this mischief." So one, two times or stare at him. So with this stare, if that student agrees, then he sits calm.
Yes.
Otherwise, what happens? The student is so mischievous that he is not following the orders of his teacher.
Mm-hmm.
Then, after frustration, teacher says, "Ki hold his hand and just tell him go out of the class."
Correct.
So this going out of the class
Mm-hmm.
is panchakarma.
Okay.
Before that, there is shaman chikitsa.
Mm-hmm.
Means generally we doctors try to pacify the disease and with the medicines.
Correct.
But when some diseases they are like mischievous, like that student, we have to aggressively pull that disease toxins and throw it out of the body.
Right.
And then the class is very peaceful and things are okay. Similarly, the body becomes healed very nicely. But for this aggressive procedure,
Mm-hmm.
you cannot directly go and start the panchakarma.
Correct.
The in shloka actually they have told this example which I am stating there.
Yes.
So when we have the wooden stick which is dry in
Mm-hmm.
nature, if we try to bend that stick, it actually breaks down.
Correct.
And but if we keep that stick in oil for 7 days or so,
Mm-hmm.
so after 7 days, when the oleated stick we take it and try to bend
Bend it.
it, then it is actually bent, but not broken.
Correct.
Same principle is applied over there. If you
Mm-hmm.
want to do aggressive detoxification process, your
Right.
body should be prepared for that. And that preparation, that oleation is done with Purva Karma. And this Purva Karma is done in this manner. We give some oil or ghee to
Mm-hmm.
drink inside. So internally, the oleation takes place, lubrication takes place. Externally, applying oil like Abhyangam, Shirodhara or Kayasek whole body oil application. This actually lubricates the body inside. And Swedanam is done. Swedan is heating steam. So that actually releases the toxins very easily. It
Correct.
prepares the body for Panchakarma.
Right. Right. So we spoke about the introduction part. We spoke about the processes also, and
Yeah,
also the fire core therapies.
yeah,
Now let's talk on the benefits of the Panchakarma.
yeah.
So, what is the key physical, mental, and spiritual benefits of Panchakarma?
Yeah. Panchakarma, as we discussed, it's a comprehensive and holistic approach to heal the patient. So, prasanna atma indriya mana swastha iti abhidhiyate. Ayurveda has its aim
Yes,
as
yes.
Ayurveda considers the patient swastha, healthy,
Mm-hmm.
only then when his body, mind, and spirit they are blissful.
Correct.
So, of course, if Panchakarma is aggressively, comprehensively one of the best treatment for treating the patient, so it has target on body, mind, and spirit.
Spirit.
So physically, as we saw, the natural detoxification process, that is the toxins are thrown out of the body from the nearest root.
Mm-hmm.
Second, when the throwing toxin takes place, then the channels are cleaned,
Right.
Then the channels are the balance of doshas, Vata
Correct.
Kapha is reinstated. Then the physical well-being takes place and patient feel physically relaxed.
Okay.
And at mental level, when patient is physically relaxed, it actually culminate into mental relaxation.
Correct.
So when mental relaxation is there, then stress hormones goes down,
Correct.
stress comes down. As stress comes down, patient's mind is at rest, it can sleep nicely. So sleep or insomnia also is improved. The
Correct.
patient sleeps nicely.
Right.
Mood enhancement takes place, and
Mm-hmm.
as your mood is enhanced, then the depression level also goes down. We have seen that after giving panchakarma, some of the patients actually, the medicine requirement goes down.
Correct.
So mentally and spiritually, what happens actually, as I can share this example. One of the
Yes.
patient from Russia, we administered woman to that patient, and after performing woman and sansarj and post panchakarma treatment,
Mm-hmm.
that patient actually shared by his own ki, sir, after having woman panchakarma, the scripture reading, when I was reading the scriptures
Hmm.
before panchakarma and now,
Correct.
there is a vast difference
Hmm.
in understanding.
Correct.
How we can understand this? Because spirituality is subtle, and how this can explain.
Right.
So as the detoxification takes place,
Hmm.
the
Correct.
lightness in the systems
Mm-hmm.
actually increases the sattva guna inside, mode of goodness.
Right.
When your mode of goodness increases, then spiritual understanding improves.
Right.
During while doing this panchakarma, we can see patient become introspective, and patient can connect with the natural energy just by experiencing the peace during the treatment.
Correct.
So, mode of goodness,
Mm-hmm.
experience peace, relaxation, mental stability,
Right.
and good sleep
Correct.
actually enhances the spiritual ability of that person,
Right.
and it opens the horizon of Sahasrar, that is the Ananta horizon. It opens that capacity of that patient. So,
Correct.
this Panchakarma actually helps at physical, mental, and spiritual level.
Right. Correct. And these are the three important aspects, that is physical, mental, and spiritual as well.
Yeah, yeah. So,
Right, sir. Other question is, how does Panchakarma helps in managing the chronic conditions like diabetes,
yeah,
stress disorders, arthritis, and even fertility?
yeah, yeah.
So, can you just throw a light on it?
Yeah, actually, all the chronic diseases like diabetes, arthritis, as you mentioned,
Yes.
we see the underlying cause of all these diseases is inflammation.
Correct.
In Ayurveda, it is called as Shotha. Shotha means the abnormal lifestyle, abnormal dietary habits, and the stressful situations
Right.
generates toxins within. It creates Daha Raga Pak, that is rhubarb, dollar, calor, pallor.
Okay.
The symptoms mentioned in allopathy, modern science, as the symptoms of inflammation,
Mm-hmm.
they're exactly translated like from Sanskrit. It is
Okay.
as same as that. So
Correct.
Shot is inflammation, and the inflammation is the basic cause of even diabetes and arthritis and other skin ailments, autoimmune disorders also.
Correct.
So this inflammation, as the detoxification takes place, toxins are thrown out.
Mm-hmm.
Then the inflammatory cause is these toxins only.
Correct.
So when the toxins are gone or reduced up to certain quantity,
Mm-hmm.
the inflammation goes down.
Correct.
So we have seen as inflammation goes down, mental health improvement is there, clarity of thoughts is there,
Right.
physical lightness is there, weight management is there. So
Correct.
weight management, reduced stress, and reduced inflammation actually improves the insulin sensitivity.
Correct.
When insulin sensitivity increases, the diabetes, the blood sugar level actually goes down.
Mm-hmm.
The utility of insulin, because the cellular wall hypertrophy is reduced due to this panchakarma,
Correct.
especially woman and viration,
Right.
the requirement of the medicines actually goes down.
Mm-hmm.
We may not say that complete medicines are actually stopped, but some
Right.
cases it happens.
Correct.
But still, the requirement of medicine goes down drastically.
Mm-hmm.
As patient gets the habit of following good lifestyle, he is helped very nicely there. Arthritis also, inflammation goes down, the
Correct.
joint mobility increases, and
Right.
pain is reduced when you do
Mm-hmm.
panchakarma basti.
Right.
And in skin, like eczema is there, psoriasis and other elements are there,
Correct.
diseases are there. For that, viration and woman and even basti helps at certain degree to help improve the blood purification.
Correct.
because all the diseases are blood impurities causes skin diseases.
Right.
So the Rakta Mokshan and Virachan actually helps over there.
Correct.
And even fertility. We have seen like one of the case tubal blockage. So that lady actually she got first child
Hmm.
as a girl, and
Hmm.
after that 6 years she did not get any child.
Oh.
And seventh year of her marriage, she actually ended up into our clinic, and she said her stressful story. Said my mother-in-law and father-in-law they are, and all the relatives actually they are
Hmm.
bringing pressure upon me, and we have found that my both the tubes are blocked.
Okay.
I said, oh, how did you get some tuberculosis or some infection like mumps like that?
Hmm.
She said, sir, yeah, I got tuberculosis last 2 years back.
Okay.
So generally tuberculosis causes the tubal blockages. So we advised her Virachan Panchakarma, Panchakarma, and some medicines local application. And you would be surprised to know within 6 or 7 months, actually her both tubes got patent,
Oh.
and she conceived a child.
Oh.
And first was girl child, then was second boy child.
Okay.
And I just met her before some days,
Hmm.
and jokingly both of husband and wife they were saying, sir, your treatment was such a powerful, we have got third
Yes.
child also. So after this child
Yes.
becomes 1 year, we
Right.
conceived again third child.
Okay.
So like that, so there are very nice
Wow.
stories of panchakarma in infertility also.
Correct.
So
Is there any age criteria ki at this age only we need to go for Panchakarma?
yes, of course, because as we see, we cannot hold ear or hand of the old people.
Correct.
We can just pacify them, and they actually naturally they get pacified.
Correct.
Similarly, old people, pregnant ladies, and very small children, and those are vulnerable children, uh, vulnerable people.
Hmm.
So actually, we should not perform this panchakarma because it
Panchakarma.
becomes difficult for them to
Correct.
follow our
Yes.
restrictions very stringently.
Hmm.
So generally, their body also is not ready. Like pregnant lady, if
Hmm.
we administer even nasya or oil application, forget
Right.
about panchakarma. If
Right.
even we apply oil, the pregnancy it's not allowed.
Okay.
So the delicacy of these cases, they can't tolerate this aggressive treatment.
Correct.
So certain contraindications definitely are there. So
Okay.
that's why you need to approach the doctor.
Hmm.
So as per age also and as per the condition also, we can perform panchakarma at certain conditions.
Correct. Right. Does Panchakarma boost our immunity and improve overall energy levels?
Yeah. Yes, of course. Because as I explained earlier,
Yes.
that roga sarve api mande agno,
Hmm.
all the diseases are due to mand agni, that is low
Correct.
digestive fire,
Right.
according to Ayurveda.
Hmm.
And all the diseases mean all the diseases except accident.
Correct.
In accident also, after some time, the doshas get involved and the digestive fire goes down. Then toxins are generated inside.
Right.
So the treatment lies here is improving the digestive fire.
Correct.
So acharyas have equated this digestive fire to our immunity.
Hmm.
One whose digestive capability is very good, his bala vyadik shamatva goes up.
Correct.
That is, immunity goes up when your digestive fire is good.
Right.
So, how digestive fire goes down? The
Hmm.
toxins accumulation.
Correct.
Toxins are accumulated, the channels are obstructed, and the as the constipation is there, how you can push food inside?
Right.
Two,
Right.
3 days the person is not having motion, so it doesn't feel hungry. Then
Correct.
digestive fire goes down.
Right.
So what we have to do is detoxify, clean the system, digestive fire rejuvenated.
Correct.
And as the rejuvenation takes place,
Hmm.
automatically immune boost take place.
Correct.
So new cells are generated,
Hmm.
and even like if there is immune system is a army,
Correct.
some naughty person is there, like some person is coming with AK-47. So you have to have your army equipped with AK-47.
Yes.
But if there is obstruction in between army and that person,
Yeah.
like that Taj Hotel function, Taj Hotel thing,
Hmm.
so army could not reach that person.
Right.
Why? Because the toxins are obstructing the channels.
Correct.
So detoxification, channels are open, army is here, the thief is there.
Correct.
So they can target the thing. Similarly, the Panchakarma actually enhances the capability of a body
Correct.
to boost the immunity
Right.
and fight the diseases. Second consequence, if you do good panchakarma, they have said asansargo. Asansargo means if you do panchakarma,
Mm-hmm.
the recurrent infections rate goes down.
Okay.
That's the explanation, and which we
Correct.
see actually.
Yes. Right. So, requesting our viewers and the participants to kindly drop down your queries relating to the today's topic, that is Panchakarma and its benefits, and also regarding Ayurveda. If you want to know anything, just drop down your queries in the chat box. Also, requesting you to please check the bottom of your screen. There is the contact numbers which have been displayed. You can connect to us for organizing such kind of sessions for your congregation or your respective group. Also, you can connect to us on Ask Bhakti through live chat for all your healthcare needs. Also, you can see the ISKCON Devotee Healthcare Services banner on your screen stating about the offerings what we give, 24 by 7 helpline number, and online chat services for all your healthcare needs. You can also get the information by scanning the QR codes, which is readily available on your screen. Uh, who is an ideal candidate for Panchakarma therapy, or there are any seasonal Panchakarma therapies which can be beneficial on a particular season?
Yeah. So we have not discussed this point.
Yes.
So panchakarma is actually two ways, as some of us or someone brings new car in
Correct.
his vicinity, and we see the on manual there is clear cut information that
Hmm.
five after 5,000 kilometers or first 3 months you have to come and serve the model.
Correct.
So we see the car is new, there is no need of getting cured of some problem
Yes.
of that car, because there is no problem in car as such.
Yes. Yes.
But the car needs regular servicing
Mm-hmm.
just for enhancing the capacity of the car or keeping the car's capacity intact.
Correct.
Similarly, nature has given us this way of shodhana karma, that is panchakarma.
Mm-hmm.
So that can be done for healthy person also,
Correct.
not only for diseased person.
True.
So there is a season like after 5,000 kilometers. Similarly, there are the seasons where we can do certain panchakarmas like Vasanta season, Vasanta Rutu, that is after Vasanta Panchami, that is around in February, March, you can do Vaman Panchakarma, that is for
Okay.
kapha, vomiting.
Right.
Virechana is in autumn season, that is Sharad Rutu, that is September, October.
Correct.
And Varsha Rutu, that is rainy season.
Mm-hmm.
Basti is the best panchakarma which can be done
Okay.
by any healthy person.
Okay.
And here again, the contraindications like pregnant lady and other those are there that
Right.
doctor will actually decide.
Yes.
But any healthy person, like new Mercedes or new any car,
Mm-hmm.
to get his regular services in
Correct.
order to keep his functions intact.
Right.
So they can do this seasonal panchakarma, and all of course those who are deceased,
Mm-hmm.
they can do any panchakarma at respective times which is required by the dosha condition.
Correct. Right.
And again, those who are having skin diseases, they can do panchakarma.
Mm-hmm.
Respiratory recurrent diseases like allergic asthma, allergic bronchitis, allergic cough,
Correct.
obesity, weight management, metabolic disorders,
Right.
and especially insomnia,
Mm-hmm.
uh, migraine, and some skin diseases as explained, reproductive system disorders like infertility.
Correct.
So yeah, in these conditions actually panchakarma can be done under the
Mm-hmm.
supervision of with
Correct.
doctors. Yeah.
Correct. Right. Are there any specific signs or symptoms indicating the need of Panchakarma?
Yeah, so I explained actually the names as like respiratory tract. There are
Right.
signs,
Hmm.
recurrent. Even if you take some anti-allergic and some antibiotics, again within 15 to 20 days the infection goes up, the inflammation causes you breathing difficulty.
Right.
These are some signs of respiratory tract disorder, or
Correct.
some allergic of some dust is there, dirt is there. We have seen actually some patients, they have dirt and dust allergy.
Correct.
They undergo panchakarma, and after panchakarma within 1 month Dust and dirt is there only, but there is no allergy.
Correct.
So in skin diseases like acne are there. So generally hormone disorders in adulthood, especially the children develop acne,
Correct.
uh, and some eczema, psoriasis. The symptoms there we can do panchakarma,
Correct.
and metabolic disorders, diabetes,
Hmm.
arthritis. Here also we can do panchakarma.
Right. Correct. There are some modern relevances and misconceptions also. So, sir, in today's fast-paced world, how relevant is Panchakarma managing stress and lifestyle diseases?
Yeah. So there are certain misconceptions like panchakarma is age old tradition. It
Correct.
has no relevance in this fast age.
Yes.
So with that same example, new Mercedes car,
Correct.
we need to get it serviced.
Correct.
But if suppose some old 20 years old Maruti 800 car is there,
Hmm.
so the need of getting serviced
Yeah.
is more with this old car or new car.
Correct.
So old car, of
Old
course,
car.
because
Yes.
there are symptoms and some diseases in that car, some
Right.
problems are there.
Right.
So definitely you have to undergo service, otherwise you cannot run that car.
Correct.
Similarly, now this fast age of modern lifestyle, we are seeing that even you cannot get normally organically generated crops or grains in your house.
Correct. Very true.
So how to expect good health during this time?
Yes.
This time is the time where our all Maruti 800s are actually in problem. So all our bodies, whether we are young or old,
Hmm.
we have certain lifestyle disorders
Correct.
always,
Right.
and that is shown by the stress. So you can see every one person among three they are stressful now.
Yes. Very
You
much.
whether he is child or whether he is adult or old person.
Correct.
So in this fast age of life where health is the minimum, there in fact we require the service station, that is panchakarma. So panchakarma
Yes.
is very relevant for this age and era. As
Hmm.
I told ki detoxification, previous to panchakarma the allergic cough is there, after panchakarma allergic cough is gone.
Correct.
Psoriasis previous to panchakarma is there, after panchakarma psoriasis is almost gone.
Correct.
So constipation like same thing. So in this modern age
Hmm.
the diseases, their relevance of panchakarma is very very important. Some misconceptions again, one is like panchakarma is a quick fast, quick
Hmm.
fix.
Correct.
So panchakarma will not cure you within 1 month.
Correct. Right.
Actually it's a scientific process.
Right.
Panchakarma is also scientific process. It has its scientific rules, and over the time the results are very much
Correct.
expected and we get the result.
Right.
And some people say that this is only for Ayurved doctors. Not like that.
Correct.
Panchakarma can be taken by anyone
Hmm.
under the supervision of proper Ayurved doctor.
Correct.
So be ready and be ready to get detoxified and becoming lighter than
Of
today.
course. Of course. Of course.
Mm.
Let's talk about some practical insights.
Yeah.
How should one prepare for a Panchakarma session, including diet and lifestyle changes?
Yeah. So first of all, of course, I told you ki this is aggressive procedure. So
Yes.
first of all, one need to consult an Ayurved doctor.
Correct.
Understand your personality,
Yes.
understand the situation of your doshas and
Hmm.
the depth of the disease,
Correct.
whether you are eligible to get panchakarma done or not.
Hmm.
That also needs to be addressed,
Right.
and that is done with the consultation.
Right.
Second is prepare your mindset, because
Correct.
you may have to be exposed to some unfamiliar things like vomiting with bitter medicine, like you have not done in your whole life,
Correct.
and now you are sitting there and you are having bitter medicines and you have to drink 4 5 liters that.
Correct.
So that is unfamiliar, although it is unfamiliar, but it is not ghastly or it is not dangerous for you.
Correct. Right.
It is for your goodness. So be mentally prepared
Hmm.
and approach a doctor
Correct.
and be ready to committed and follow the regulations which are advised by the doctor,
Correct. Right.
and be ready for good outcome in your
True. Absolutely.
yeah.
I'm requesting the participants to please flash your questions. So, one question we have, sir: what should be the diet for gut problem with acidity, gas, and also grade 1 fatty liver. Also, is there any permanent solution? Because someone is suffering this issues from the 1 year as of now.
Yeah. So actually, fatty liver, it is uh, generally it is the effect of improper lifestyle,
Hmm.
as the sticky substances like excess oily, excess fat,
Right.
or only sedentary lifestyle. This raises the inflammation inside,
Correct.
and this affects the liver, because first site of detoxification in our body is liver.
Liver. Correct.
Anything we dump in the body,
Yes.
whether it may be your food, drinks, healthy drinks, liquid, chocolate, or chemicals or medicines,
Correct.
whatever you dump in the body or stomach, it first is checked in the liver.
Correct.
And as the dumping of toxins is more, it gets affected.
Right.
Especially like Mumbai, we are in Mumbai.
Hmm.
So fried substances like samosa and vada and all those fried non-vegetarian items, some people
Yes.
eat and some not eat. But the oil and ghee, which actually leads to this fatty liver.
Correct.
And this fatty liver is the abnormality of low digestive, that is Agni, when
Hmm.
Agni is gone.
Correct.
For that, first thing is that, as we saw the causes,
Hmm.
first thing is that be ready to follow the lifestyle diet which is lighter.
Correct.
So source the food which is maximum in organics resourcing.
Correct.
So organic grains and organic food items,
Hmm.
and which has low stickiness inside.
Okay.
Like new grain, it has stickiness inside.
Correct.
If that grain is 1 year or 2 years old, it becomes little less sticky.
Correct.
So old grain is the general advice. All the vegetables like tomato and cauliflower, you should know that tomato and cauliflower, every third day they spray the chemicals and fertilizers,
Correct.
which are the chemicals are so dangerous. I am a farmer by birth, native place.
Hmm.
So I know one day they pluck the tomato, they bring it to market. Next, they spray the chemicals so that the green tomato becomes red
Right.
tomorrow. And please believe me, if you spray one chemical on that tomato,
Right.
it takes 14 days to get removed from that tomato, and then the tomato is eligible to eat.
Correct.
So you have to resource vigilantly the substances in an organic way,
Correct.
and at first take care of your Agni. So how Agni is taken care? If you want to take care someone really nicely,
Right.
so first thing you have to do is that de-burden the person. So
Yes.
reduce the burden on that person
Correct.
if you love that person. Similarly, the Agni is also a person.
Right.
So love that Agni, de-burden that Agni. Don't eat in frequent manner. Like I eat 8 o'clock some chapati sabji,
Hmm.
then 12 o'clock some dry fruits, and then again 3 o'clock again some juice, and again 6 o'clock. Like
Right.
adhyashan,
Hmm.
frequent eating, one of the big cause to reduce the digestive fire.
Correct.
So de-burden the digestive fire. If you are adult, of course, grade 1 fatty means you are more than 40 years, I suppose. So it's good for you to eat twice a day,
Right.
9 to 11 in morning, 5
Hmm.
to 7 at evening.
Correct.
Follow that, and if nearby some Ayurvedic doctor is there, go check your pulse, understand from him
Hmm.
whether you are able to do Virechan Karma or some other Panchakarma can be done, or
Correct.
without Panchakarma also the specification of the doshas can be done.
Correct. Correct. Right. So, I believe like there is the mechanism of each organ in our body, which works on that specific time. So, can you just throw light on that? Which organ is relatively the working mechanism of each organ of our body?
Yeah, so liver actually works pitta. So
Right.
it is like pitta, kapha and vat.
Hmm.
So generally, vaya ahoratri bhuktanam te anta madhyadiga kramat.
Okay.
So vaya, ahoratra and bhukta means in your age, day night schedule, and the doshas, vat,
Hmm.
pitta, kapha.
Right.
So these three things, adi, madhya, and anta. The initial part of the day, initial part of the night,
Hmm.
kapha works there. So the organs related to kapha, their function is more during that time.
Okay.
So like respiratory tract is there, stomach is there. So the actions of those organs are more during that time. The pitta organs like liver and gallbladder and small intestine, or
Mm-hmm.
even spleen,
Correct.
Agnesha, that is pancreas.
Mm-hmm.
During midday,
Hmm.
the function is more.
Correct.
So and during midnight also the function is more.
Okay.
So while that the evening
Hmm.
last part, that is ant part, that
Right.
is the vata organs, that is large intestine working at fast speed,
Right.
and the bones and the other organs, those control the function of vayu,
Mm-hmm.
they work at evening. So in age also, vayo means age. Small children initially the kapha is dominant,
Right.
in between pitta is there. The organs in adulthood, the dominance of organs is liver, pancreas, and gallbladder. The
Correct.
overload also during that time is on that.
Right.
And in old age,
Hmm.
the organs are large intestine, bones, teeth, hair, and the hard parts
Hard.
of the body.
Correct.
They are active during that time.
Right.
So like that.
Okay. So, is there any specific time of taking the breakfast, lunch, or dinner?
Yeah. So we would like to discuss this because this is very important. As we said, ki panchakarma is needed to those
Correct.
whose lifestyle and diet is not proper, so toxins are generated. So what
Correct.
if we don't allow the body to get these toxins generated only?
Right.
So by these eating habits, especially we are discussing for all. So for children, there is not such a rule ki they should eat twice a day or thrice a day like that.
Correct.
As per the physical ability of the child or the physical playfulness of that child,
Mm-hmm.
the appetite decides the food frequency,
Correct.
but the quantity and the quality of the food definitely should be decided in this way. Organic manner, organic food, and the healthy food they should definitely eat.
Right.
But for adults, we would advise for adults more than 45 to 50 years now in modern age, two times eating is the best time, best eating.
Correct.
Up to 55 to 60 years.
Mm-hmm.
Ayurveda advises after 60 years, one main meal is the best thing for.
Correct.
Ekabhukta, they call it as Ekabhukta. But practically speaking, because people are not sleeping for 8 to 10 hours a day, they are sleeping only 6 to 7 hours,
Correct. Right.
maximum 5 to 7 hours.
Right.
So for them, they need to have proper food, but not in inadequate quantity.
Correct.
So two times meal is very good for them.
Mm-hmm.
So morning 9 to 11, they say in Vagbhatacharya also says and other Ayurveda Acharya says ki our doshas actually they come in our stomach.
Correct.
Morning after sunrise, within 2 to 3 hours the doshas are there,
Correct.
and evening before 2 hours the doshas are there.
Correct.
So when the doshas are there, that is the time to feed the organs. And when we feed those, then the doshas generation, maintenance, and the normalcy
Hmm.
kept intact.
Correct.
That's why for adults we advise two times eating between 9 to 11
Hmm.
morning and 5 to 7 at evening. Generally, what
Correct.
people do
Hmm.
in the name of intermittent fasting, unfortunately, some people follow this rule. They eat after 12 o'clock or 1 o'clock and eat at night by 9 o'clock.
Correct.
Again, that is not helpful. They
Yes.
should eat in daytime
Correct.
before 7 sunset and after sunrise 2 to 3 hours
Correct. Right.
like that.
What about our devotees who do normally the fasting process? So,
Yeah, of course, fasting is very good. In fact, fasting is the gift given by Indian tradition to the world.
correct.
So once in 15 days is Ekadashi fasting is there,
Correct.
and even some Janmashtami and some other different fasting days are there.
Correct.
So that is very appreciable, and that fasting is required for alternate food habits, or even you can fast on water or milk or even without water.
Right.
But we should remember all the things, because as an Ayurved doctor, I have uh, came across many situations.
Correct.
One person actually, one devotee, he was Pitta Pradhan personality,
Okay.
and sorry, and he followed Janmashtami without water,
Mm-hmm.
Nirjala Janmashtami,
Okay.
and unfortunately and surprisingly, by 10:30 the Abhishek was started.
Mm-hmm.
and he had the service to give the pots filled with curd,
Okay.
and this person collapsed at 10:30.
Oh.
And then I was there, so I saw him and I checked his abdomen. It was quite rigid like wood. So wood like rigidity in abdomen is like perforation taken place inside.
Oh.
So his intestine was burst, small intestine was burst due to heavy acid which was generated, but no food was there that day. So please remember, all the devotees, we are not against any fasting,
Correct.
but we are pro science.
Correct.
So that science is given by our God only.
Yes.
So Ayurveda, it says that Pitta Pradhan personality
Right.
and his lifestyle is Pitta Pradhan, sleeping late. That person sometimes may become ineligible to practice Nirjala fasting.
Correct. Correct. True.
So this rule is very important. Please get understood your personality
Mm-hmm.
from Ayurved doctor. If you want to have online consultation, you also can do it with
Correct.
Ayurved doctor in Bhaktivedanta Hospital also. But
Correct.
you should know your personality, and accordingly, Kapha Pradhan person, they can follow Nirjala Ekadashi. There is no issue with them.
Right.
So you have to find out the personality and situation
Correct. Correct. Right.
like that.
So again, requesting participants to please drop down your queries if you have any. So we can take this question, sir.
Hmm.
Recently, we heard a cricketer's wife, grade 4 cancer by
Hmm.
Ayurveda, was treated. What is your view?
Mm,
Cancer was
this is
treated by
this yeah,
Ayurveda.
yeah, yeah. This is
Yes.
this like in, you should also know the news, as out of love and out of enthusiasm, Mr. Sidhu, he has actually
Yes.
told about that.
Correct.
But we should not forget the facts. Now, I am not against Ayurveda or allopathy or modern science or
Correct.
anything,
Yes.
but we should know the reality. As he explains, ki only 3% chances were there with modern approach.
Correct.
So, as I honestly don't know completely about that case, just today I heard that some of the doctors, they have uh, all the cancer surgeons, they have come together and they have started going against ki Sidhu should
Yeah.
beg forgiveness like that.
Correct.
But the reality is reality.
Absolutely.
3% recovery was possible with modern approach.
Correct.
So there is the integrated approach. So
Right.
modern science is helping his wife to get relieved of that disease
Correct.
with the help of chemotherapy or radiotherapy. What radiotherapy I think he has given,
Yes.
and
Yes.
along with that, definitely this detoxifying diet.
Correct.
What he explained, tulsi and other items he explained, neem leaves. So it is not like that. See, our body is not deciding ki, oh, see, neem and tulsi is Ayurvedic, so I will give response to this
Mhm.
very quickly,
Yes.
and this chemical I will not give response.
Correct.
In fact, someone very nicely explained, there is a circle and there is a center of that circle.
Right.
So that center of the circle is patient,
Correct.
and the circle, a whole circle, there are sitting different pathies of doctors.
Correct.
So cancer surgeon is there, onco medicine wala doctor is there, Ayurved surgeon, Ayurved doctor is there. All nurses are there, ward boys are there. Farmer is there who is making the neem leaves and the tulsi.
Right.
All the people, they are sitting on the circle and they are just targeting towards the center, that is patient.
Patient. Correct.
So patient's benefit is at center. Then whatever has helped, there is no issue of any ego and anything.
Correct.
But the things have helped, that is helped.
Right.
But we don't know clearly ki only tulsi has helped.
Correct.
So we should not boast like that.
Mm-hmm.
So my opinion, you ask, that's why honestly I told, because I know only this much. But
Correct.
I should as an integrated practitioner,
Correct.
because I actually respect other pathies also, because Sushrutaracharya respects that. Sushrutaracharya says, Ekam Shastram Adhyano na Vidyat Shastra Nishchayaha Tasmat Bahusrutaha Shastram Vijaniya Chikitsaka. So with only one branch of science, you may not come to proper conclusion.
Right.
You need to understand many perspectives of the science. And the
Correct.
person who actually understands those perspectives and accepts and respects different perspectives, come to proper conclusion, and he can treat the patient in a better way.
Correct. Right.
So we are of that opinion. So we are not pro this or pro that.
Correct.
We are pro science.
Correct.
Whatever has helped him,
Mm-hmm.
we are pro that.
Absolutely, sir. So, requesting participants, you can check the bottom of your screen where the contact numbers have been displayed. You can connect to us for organizing such kind of sessions for your respective congregations, and you can also connect to us on Ask Bhakti for any of your respective healthcare needs. Also, you can see the ISKCON Devotee Healthcare Services banner on your screen stating about our offerings, what we offer, that is special health talks and webinars. 24 by 7 helpline number. The number is displayed on the screen for booking an appointment on priority basis and to facilitate emergency and any other queries. Also, we have the contact number of Ask Bhakti, which is an online chat services wherein you can connect with us on WhatsApp and avail all your healthcare needs. Moving on to the next question, sir.
Yeah.
We have one question in the chat box. Can uterine fibroids be treated with Panchakarma?
Up to certain size, they can be treated.
Correct.
Uh, s- Below 4 centimeters actually can be treated,
Okay.
but above 4 centimeters, generally patients don't get good results on that,
Mhm.
because the lifestyle again and the depth of the disease which is there.
Correct.
So generally below 4 centimeters we can treat the patients.
Right. Right. Correct. What advice do you have for someone considering Panchakarma for first time?
Yeah. So many of the patients, they actually go to Panchakarma first time only.
Right.
So as I told, to get anxiety reduced,
Hmm.
first visit the doctor,
Right.
understand your personality, ask all the questions and get your all queries resolved by
Correct.
him,
Yeah.
and be ready to be committed and follow the guidelines,
Right.
and have first hand experience of that Panchakarma.
Correct.
You have heard and you have become aware, and half of the awareness is not there. Doctor will give that awareness.
Correct.
Get first hand experience of that Panchakarma.
Right.
And I would suggest, if you are new really,
Mm-hmm.
first you get some Purva Karma, at least one massage at that center,
Correct.
and get it done. Get convinced with the approach and the system. And when do you have the good experience, then go for the big venture,
Correct.
go for Panchakarma, like
Correct.
that.
Right. Right. Correct.
So if you are new, then you can approach in this way.
Can you throw some light on the Veda Pulse or Nadi Pariksha?
Yeah. So there are Ashtavid Pariksha in Ayurveda.
Correct.
So Ashtavid Roga Pariksha, Rogna Pariksha.
Mm-hmm.
So as I explained you, Bahu Vidaha means many ways, just like in diseases and modern investigations are there.
Right.
We do IgA testing,
Mm-hmm.
X-ray testing,
Right.
different testings we do,
Correct.
and all those testings are there to unify the intellectual analysis and come to a proper conclusion of diagnosis.
Correct.
In that way, this Nadi Pariksha is one of the tool to diagnose the disease in Ayurveda, like Mala Pariksha, Nadi, Mutra, Jivva, Sparshan, Druk, Akruti, different. Like how is your stool is, so we examine the stool. So we allow that stool to deep into the water. If it deeps in, then it is Sama stool. If it is floats in, that is the normal stool.
Correct.
So we have certain experiences. So when the stool is nirama, that time certain pulse is there. So if that pulse matches with that stool, then the diagnosis is fixed. So pulse is generally in previous ages, some of the parts,
Hmm.
they used to have this burqa or the pallu patha.
Correct.
So we could not see the tongue of those people.
Mm-hmm.
So if you're not able to see the tongue, then what is the tool to understand? So
Correct.
pulse,
Pulse. Okay.
sparshan chikitsa.
Right.
So the pulse is there. So with that pulse examination, we come to a conclusion of the diagnosis, and accordingly we can treat the patient. This is manual pulse.
Correct.
Now see the manual pulse, and these are based on the scientific scriptures in Ayurveda.
Correct.
So, like suppose Vayu is there. So Vayu has five types.
Mm-hmm.
So Pranavayu. So Pranavayu, where it stays, the knowledge is there.
Correct.
How it gets affected, that is there.
Yes.
After affecting, how it looks like, how the what are the symptoms which are generated after prana is affected.
Mm-hmm.
And when we check the pulse, that time there is an area of prana.
Correct.
So there we come to know ki his prana is affected.
Right.
Then he tells something, so we matches that. This knowledge scientifically can be implied in software language.
Correct.
Similarly, Sanskrit is used in software language
Right.
quite
Right.
a manner. So this knowledge is being used in software, and one of the scientists from Russia actually, along
Correct.
with our Ayurvedic one scientist from India,
Mm-hmm.
both of they have developed this Veda Pulse. Actually, we have that Veda Pulse in our Bhaktivedanta hospital. It is
Yes.
like intensivist taking help from ECG.
Mm-hmm.
Even before ECG, he has diagnosed that this person has heart
Correct.
arrest.
Right.
Similarly, Veda Pulse is also helping the Ayurveda doctor to uh, get the diagnostic conclusion, and it actually helps to the patient also to understand,
Correct.
see what is happening inside.
Right.
So the Veda Pulse is there. Our hospital is the first hospital which started Veda Pulse in multi-speciality in
Yes.
India.
Yes.
So we are very happy to share that.
Right. And Bhaktivedanta Hospital is a unique institution wherein we give pradhanya, yes, to
Yeah,
all
yeah,
the
yeah,
pathies,
yeah, yeah.
allopathy, Ayurveda, homeopathy
Yeah,
alike.
in that Veda Pulse, actually, you not only see the dosha's condition, but you
Right.
can see your aura,
Right.
where most of the energy is flowing.
Correct.
What is the situation of your chakras?
Yes.
And because it is a Vedic science,
Correct.
chakra and aura, prabha, this science is very much in Ayurveda.
Correct.
Veda.
Yes.
So, as your prana is affected, the prana affected, the chakra related to prana is affected.
Correct. Right.
So, we have those treatment plans for those
Correct.
affected chakras.
Right. Right.
So Veda Pulse actually shows you that in front of you.
Right. Right. Correct. So we have one question. Can cervical spondylitis be treated with Panchakarma?
Yes, cervical spondylosis definitely can be treated. Actually, it is caused due to lack of nutrition on time, lack of sleep, and
Mm-hmm.
excess utilization of the muscles.
Okay.
So generally, it is seen in surgeons, those who are standing, those who are using computers for 8 to 9 hours and eating anytime very late and sleeping very late,
Yes.
especially those dry, like now the winter is coming.
Correct.
December, I asked the patients, do you eat mutter? They say, sir, mutter is 20 rupees a kilo. So daily we have mutter pulao, mutter sabji, mutter pakoda, mutter chapati, mutter roti, everything mutter. So this mutter gives rise to cervical spondylosis.
Oh.
So there we use generally leech application
Okay.
and agni karma.
Mm-hmm.
And beyond that, if not solved, then we use basti panchakarma.
Correct.
It nourishes the system, fills up the vacancies which are generated by Vayu.
Correct.
So the Basti helps to pacify the Vayu, and the cervical spondylosis is resolved very nicely.
Correct.
We have our surgeons in our hospitals, the sisters also. Uh, Due to standing for
Standing
8
for
hours,
time.
10 hours,
Yes.
they get spondylosis, they come in.
Correct.
We just apply leech or Agni Karma. Within 5 minutes, they are gone to their work.
Correct. Correct. Right.
So Panchakarma we use in
Right.
spondylosis.
Right. Other question we have: can Panchakarma treat blood flow from bottom towards upwards
Yeah. Yeah, the
from
varicose.
legs?
Yeah,
Yeah.
yeah, yeah. So generally, varicose veins we see the flow due to the muscular elasticity. Venous wall muscular elasticity goes down, and the laxity comes there.
Correct.
So the veins becomes lax, and the blood column, which is impure blood, it stays below.
Mm-hmm.
So for that, we have certain panchakarmas also. Basti also helps there, but Udvartan Purvakarma helps there. We
Udvartan,
use
Purva Karma.
Udvartan and certain directed Panchakarma. It helps actually the blood column to flow towards heart.
Correct.
Yeah.
Right.
So
True.
Udvartan and Basti helps there.
Correct. Right. So as time is tickling, what is the last message or advice would you like to give to our attendees and listeners who are interested to explore Panchakarma?
Yeah. I would I would like to share with you, because we are now acting locally but reaching globally.
Correct.
So now Ayurveda is similar only. So this way, this year we celebrated Ayurveda Day globally. So
Right.
I would request all of you, Ayurveda is a mother of medicine.
Yes.
So don't come to the mother when things are gone out of your control. Anything which is there, you just come to Ayurveda, go to the Ayurveda doctor, understand your personality, check it whether certain Panchakarma is suitable for you. If you are healthy, get seasonal Panchakarma done under proper supervision.
Correct.
If you are sick, get curative Panchakarma done under proper supervision.
Right.
But at least once you should try Panchakarma,
Correct.
because बस्ती द्यावा, बस्ती घ्यावा, बस्ती जीवाचा विसावा. One of our Ayurveda doctor
Yes.
says,
Hmm.
if you take basti, give basti, it gives you relaxation and visava. That is
Absolutely.
mood enhancement.
Right. Right.
So I would request all of you to find out which is suitable for you. Even you can stay, come here in Bhaktivedanta Hospital from any corner of the globe. Come here, take benefit of Panchakarma, even for preventive and curative both
Correct.
approaches.
Correct.
We
Correct.
have both the places in hospital and in resort like system.
Yes. Right. We can take one last question, sir. How to get rid of eczema, psoriasis, dark spots?
Yeah, so for that you really need to understand the causes for that,
Correct.
because it's most of the cases it is autoimmune, that is your immunity has been fired. So your immunity doesn't know which is my cell and which is others enemy cell.
Right.
So that immunity really you need to work for digestive fire and the
Yes.
viruddha ahar,
Correct.
the incompatible food habits that needs to be really restricted. And Vaman, Virechan and Rakta Mokshan, these
Hmm.
are certain panchakarmas which are very helpful for eczema and psoriasis.
Correct.
So you can really get it done, because without panchakarma, the recurrence of psoriasis and the eczema is not
Correct.
taken care
Right.
easily.
Right. Correct.
So you need holistic and comprehensive approach towards healing this eczema and psoriasis, because eczema is very vast terminology.
Correct.
So for that you really need to understand the cause, under supervision, use panchakarma, medicines, and diligent following of the lifestyle.
Correct. Right. So here we can end the today's session. I'm
Mm.
sure the viewers might be having more kind of questions, but definitely you can put down your queries in the chat box, and definitely we can get back to you with the answers. Uh, Again, so thank you so much, Dr. Nanasaheb Memane,
Thank you.
for giving the insightful knowledge about the today's topic, which was on Panchakarma and benefits. Definitely, it will help us in regenerating, detoxifying our body, and our, of course, the overall well-being of every individual.
Yes.
So, Hare
Thank
Krishna,
you.
and
Hare
thank you.
Krishna.
Take care and stay fit.